Hello, my name's Maria and I'm going to be your nurse today. I'm just going to do a general history on you. Is that okay?
Sure.
And what's your name?
Marilyn Bonucci.
Okay. Can you spell your last name for me?
Bonucci.
Okay. And where do you live?
3170 Bloomfield Lane, number 920, Auburn Hills, Michigan.
Okay. And what's your cell phone number? Do you have a cell phone number?
Yeah,
Phone number?
805-406-0182.
Okay. And what is your date of birth?
September 7th, 1952.
Okay. And your birthplace?
Boston, Massachusetts.
And what is your current age?
67.
What gender do you identify as?
Female.
And what is your marital status?
Single.
Okay. And occupation?
Nursing student.
Okay. That's good. What race do you identify with?
Caucasian.
Okay. And you currently don't have an employer if you're a student,
No.
right? Okay. Just wanted to confirm that. Okay. Source and reliability is of self. And what is your reason for seeking care today?
I'm just giving a physical.
Okay. And how would you rate, or how would you say your current history and our health is today?
I am well.
Okay. You feel great all around. Okay. Now, how would you describe your past health?
My past health, I've been in good health.
Okay. And what childhood illnesses do you have?
Have I had measles, chickenpox, rubella, and mumps?
Okay. And any car accidents or accidents in general?
No.
How about injuries?
No.
And any serious or chronic illnesses?
No.
Okay. Have you ever been hospitalized in your past?
I've had surgeries where I was hospitalized.
And what were the surgeries for?
One was hemicolonectomy,
Okay.
and one was a knee replacement.
Okay. All right. And what knee was that?
Left knee.
Okay. And when was that approximately?
The knee replacement was April of 2018.
Okay. And then how about the colonectomy? Hemicolonectomy, I should say.
It was December 1996-7.
Okay. Now, have you ever been pregnant?
Yes.
How many pregnancies have you had?
3.
Okay. Any Gravata stillborn?
No.
Any preterm babies?
No.
And how about any abortions or miscarriages?
I've had a miscarriage.
And how many children do you have living right now?
2.
Okay. Now, for your pregnancies, we'll start with the first child. When was that?
He was born April 5th, 1993.
And how long did you carry? How many weeks did you go to?
39.
How many hours of labor were you in?
26.
And what was the baby's weight?
9 pounds and 10 ounces.
And the sex?
Male.
And did you have vaginal or cesarean?
Cesarean.
Okay. And how would you say the health of the baby was at that current state?
Excellent.
Good. And how about your second child? When was that? What date was that?
She was born August 28th, 1997.
Okay. And how many weeks did you carry her till?
35.
Okay. And how long was your labor?
2 hours.
Okay. And what was the weight?
8 pounds, 6 ounces.
Okay. And sex?
Female.
And how about cesarean or vaginal?
Cesarean.
Were there any complications?
I had high blood pressure.
Okay. And how about the baby? How was the baby?
No, the baby was in excellent health.
Okay. Now, immunizations. Have you had your immunizations?
Yes.
And what immunizations have you had?
I've had the flu and MMR and varicella and Hep B, 2 of the 3 series, one,
Okay.
and tuberculosis test.
Okay. So you did like the Tdap.
Tdap, yes.
Okay. Okay. And when was your last examination?
August of 2019.
Okay. And do you have any allergies? At least
No.
that you know of? Okay. All right. And what current medications are you on?
Levothyroxine, Celexa, Wellbutrin, and Lipitor.
Okay. All right. Now, your family history. I'm going to ask you about some diseases, and if you can remember or know, that would be great, okay? And it's in relation to your family history,
Okay.
okay? Okay. Any family history of heart disease?
Yes.
Okay, who did?
Father, uncle, brother.
Okay. How about high blood pressure?
Grandmother, father.
Okay. Any strokes?
Uncle,
And was that on your
paternal
paternal
side.
side? Okay. How about diabetes?
No,
All right. And blood disorders?
no.
Okay. How about breast or ovarian cancer? Anybody there?
Ovarian cancer for my maternal grandmother.
Okay. How about sickle cell? Any of that?
No.
Any history of cancer in general with your family?
Not besides the ovarian cancer.
Okay. How about arthritis?
Arthritis, my brother has arthritis.
Okay. How about allergies? Any common allergies in your family that you know of? Anyone?
No,
Okay. How about asthma?
my daughter.
Okay. Obesity?
My mother and my sister.
Okay. How about alcoholism? Is there any alcoholism or drug addiction in your family?
There has been, but not presently.
Okay. And who would you say that was? Like a parent, siblings?
That was my sister, my brother.
Okay. All right. How about any mental illness? Has there been mental illness?
Yes, my brother has schizophrenia and my sister has bipolar.
Okay. Any suicide?
No.
Seizure disorders? Sorry, seizure disorders?
No.
Kidney disease?
Me.
Okay.
Um,
Was it renal disease? Were you?
No, it was no disease. It was failure, kidney failure.
Okay. Any tuberculosis?
No.
Okay. For your general overall health, What would you say your weight is right now?
195.
And have you gained, lost any weight?
Well, I've lost about 10 pounds in the last 3 months.
Good for you. What have you been doing?
Eating less.
That always helps, you know. That always helps. How about any feelings of fatigue, weakness, anything like that?
No.
Or malaise?
No.
Okay. How about fever?
No.
Chills?
No.
Sweats or night sweats?
No.
Okay. History of any skin disease?
No.
Okay. Any pigment color change?
No.
Change in moles?
No.
Excessive dryness or moisture?
No.
Any itching, pruritus?
No.
Okay. And then any excessive bruising? Do you bruise easily?
No.
Any rashes or lesions that you're concerned about today?
No.
Okay. Have you had any hair loss recently or through the years at all?
No.
Okay. And nails, any change in the shape, color, brittleness? Are they brittle or rigid?
No.
Okay, okay. Okay. So, do you ever get any sunlight?
Very little.
Okay. Well, I recommend at least 10 to 15 minutes a day to get your vitamin D levels up. If you can't, you can always take a supplement, vitamin D supplement, okay? Okay. Any unusual, frequent, or severe headaches?
No.
Okay. Any head injuries?
No.
How about dizziness?
No.
Vertigo?
No.
Okay. Okay. Any difficulty with vision?
I've got my eyeballs aren't completely spherical.
Astigmatism?
Astigmatism.
Okay. Okay. Any diplopia, where you double vision?
No.
Redness or swelling?
No.
Watering, discharge?
No.
Glaucoma, cataracts?
No.
Okay. All right. And for your astigmatism, do you see a doctor,
Yes,
eye
I
doctor?
see an eye doctor every year.
And do you wear glasses, contacts for that?
Yes.
Okay. When was your last vision check?
February of 2019.
Okay. Any earaches, infections of that nature in your ears?
No.
Any discharge?
No.
How about any tinnitus?
I had tinnitus about 20 years ago for a few weeks.
Okay. Anything that you can relate that to in particular? No. Okay. Okay. Well, you don't have any current hearing loss right now that you need to follow up with.
I have a slight to moderate hearing diminished.
Okay, and do you see an ENT ever?
Yes, I saw one a couple of months ago.
Okay. And how was the checkup? How were the results of that?
He said that I don't need a hearing aid and that my hearing was diminished somewhat.
Okay, which is normal. Okay, how about any discharge from the nose? Any drainage, like mucus,
No.
watery? Okay. Any severe colds or frequent colds that you get?
No, I don't get colds much.
How about sinus pain?
No.
Do you feel like you have any nasal blockage?
No.
Okay. And any nosebleeds?
No.
Any history of allergies
No.
or hay fever?
No.
Any changes in the sense of smell?
No.
Okay. Okay. How about mouth pain? Do you have any mouth pain or frequent sores in the throat ever? In general?
No.
Okay. Okay. Any bleeding of the gums?
No.
Toothaches?
No.
Lesions in the mouth or tongue?
No.
Okay. Have you ever had dysphagia? It's a difficulty
No.
swallowing. Okay. How about hoarseness or voice?
No.
And what is your pattern of daily dental? Do you brush?
I brush my teeth every day and water pick and use mouthwash
Good, that's
every
good.
day.
Do you have any dentures or ridges?
No.
Okay. When was your last dental check?
September 2019.
Okay. Do you have any current neck pain?
No.
Okay. Any feeling of limitation of
No.
motion? Okay. Any lumps or swelling that you felt?
No.
Okay. How about any enlarged nodes, lymph nodes? Those would be right here.
No.
Any goiter?
No.
Okay. Okay. Have you had any breast pain?
No.
How about lumps? Have you ever had any breast lumps?
No.
Okay. How about any swelling?
No.
Okay. Have you had any breast disease before?
No.
Nipple discharge?
A little bit a few years ago.
Have you seen somebody for that?
I did,
Okay.
and they didn't say much, and it went away.
Okay. Okay. All right. How about in the underarms, the armpits? Do you get any tenderness in there?
No.
How about any lumps or swelling in there?
No.
Okay. And do you perform regular breast exams on yourself?
Yes.
Do you follow up with your OB-GYN every year for your checkups?
Yes.
Okay. Okay. And when your last screening, what did they say? Was negative or positive?
Negative pap.
Okay. Negative pap. Okay. Good. Any history of lung disease?
No.
Emphysema, asthma, bronchitis, pneumonia?
No.
Okay. Any wheezing of the chest or chest pain when breathing?
No.
Any shortness of breath?
No.
Okay. Okay. Any cough, sputum?
No.
Okay. How about hemoptysis?
No.
Any toxins or pollution exposures?
No.
And when was your last chest x-ray?
Oh, I think it was 5 years ago.
Okay. Okay. Any precardial, or resternal pain, which would be like right here. Do you ever
No.
have you had any pain right there?
Well, I have a little bit, yes.
Okay. Okay. Any palpitations?
No.
Okay. Any cyanosis? Any bluing of your hands, fingers?
No.
Okay. Any trouble breathing?
No.
Okay. Any orthopnea? Sorry.
No.
Okay. How about any urination at night? Do you frequently urinate at night?
No.
Okay. Any swelling?
Swelling of what?
Well, in your chest or in and around your heart.
No.
Okay. Okay. Or it could be down your arms too. Anything vascular?
No.
Okay. Okay. All right. And so, any history of like a heart murmur?
No.
How about hypertension?
Yes.
And are you seeing somebody for that?
Yes, I have. And I used to take medications, but now it's more under control.
Okay. Controlled. Any history of any coronary artery disease?
No.
How about anemia?
No.
When was your last ECG or heart test in general?
It was about a year ago.
Okay. And how were the results of that?
They said I had a slight narrowing of one of my arteries in my heart, but that it wasn't serious.
Okay. Okay, how about, do you feel any coldness or numbing and tingling in your hands and feet or
No.
legs?
No.
Okay. How about swelling? Lower legs. Do you get any swelling down there?
No.
Okay. Any discoloration of your hands or feet?
No.
Blue, pale, mottling?
No.
Okay. And how about any varicose veins, spider veins, any of that?
No.
Okay. Any vein complications?
Well, I have one vein that sticks out, and it has ever since I was about 9 years old.
So you have a varicose vein.
Yeah,
Okay.
that I've had almost all my life.
Okay. And how about any intermittent claudication?
No.
Okay. Any thrombophlebitis? Anything?
No.
Okay. Any ulcers?
No.
Okay. Yeah, I just recommend that you wear support hose for your lower legs. It's good at keeping the circulation. And have you ever followed up with any cardiologist before?
Yes.
Okay.
I see one every 6 months.
Okay. And I also recommend you avoid crossing your legs, standing or sitting for long periods of time. Okay.
Okay.
Do you have any appetite or food intolerances?
No.
Do you have a problem with appetite?
No.
Okay. Any dysphagia?
No.
Okay. Any heartburn?
Occasionally.
And how about indigestion pain?
No.
Okay. Any other abdominal pain?
No.
How about pyrosis?
No.
Okay. Any nausea or vomiting?
No.
Okay. Any history of ulcers
No.
in the liver or gallbladder? Any problems with them?
My gallbladder has been removed because it had stones.
Okay. And any history of flatulence?
Occasionally.
And frequent bowel movements? How regular are your bowels? Do you every day?
Regular, every
Okay.
day or twice a day.
Oh, okay, good. Any recent changes in your diet or in your...
No.
Okay. How about any changes in your stool characteristics?
No.
Any constipation or diarrhea?
No.
Okay. Any black stools or rectal bleeding?
No.
Any rectal conditions for that matter?
No.
Any hemorrhoids?
No.
Fistulas?
No.
Okay. And for your heartburn, I recommend that you use antacids, and you don't need laxatives because you are regular. And is your ENT aware of that you have heartburn?
My
Or
general
your
practitioner
Okay.
is aware.
Do
Yes.
you take anything currently for it?
Well, I have some Miprazole,
Okay.
and I take it as needed.
Okay. Good. Any frequency of urgent or urgency for that matter of urinating?
Yes.
Okay. And any nocturia?
No.
Okay. How about any oliguria? Oliguria is not urinating enough.
No.
Okay. Any hesitancy or straining when you do?
No.
Okay. Any narrowed strain?
No.
How about urine color? Is it dark?
No, it's
pale
normal
yellow.
color.
Okay. Cloudy, no cloudiness or redness in there?
No.
Okay. And any incontinence?
No.
History of any urinary diseases?
No.
Kidney disease?
I've had kidney failure
right.
before.
How about kidney stones?
No.
And any urinary tract infections?
No.
Any pain in the flank or groin area?
No.
Okay. How about in the lower back?
Yes, I've had pain in the lower back.
Okay, I recommend that you do regular use of Kegels, And then if you do have any infections, to report to your OB-GYN.
Okay.
All right. In the past, how was your menstrual? Was it regular?
Yes. And not too much flow.
Okay. And do you know ballparkish when you started your period?
Yes, it was 13 years and 11 months.
Okay. And when was your last period?
When I was 51 and a half.
Okay. You said it was pretty regular, so there was no amenorrhea or menorrhea?
No.
Okay. Did you have PMS symptoms without your
No.
periods? Okay. Okay. Any dysmenorrhea or intermenstrual spotting?
No.
Okay. Any vaginal itching or discharge right now? Or
No.
in past? Okay. All right. And what was the age? Oh, you get me the age of menopause already. Sorry about that. And in your menopause, how would you say you have any signs or symptoms from it?
Well, I would have hot flashes sometimes.
Okay. Do you do anything for that?
Did I do anything? No, I just waited
Okay.
for it to pass.
When was your last pap smear?
September 2019.
Okay.
It was negative.
Okay, good. Okay. Sexual health. Are you presently in a relationship of intercourse involving intercourse?
No.
Okay. Are aspects of your sex satisfactory to you or your partner?
I don't have a partner.
Okay. Okay. Any use of contraceptives?
No.
Okay. And is your contraceptive? Oh, you don't use them. Okay. Do you use condoms when you do have intercourse?
No.
Okay. No. Any history of any sexually transmitted diseases?
No.
Okay. Any history of arthritis?
I get a little arthritis in my knees
Okay.
from being a runner.
Okay. How about gout? Do you have any history of gout?
No.
Any joint pain, stiffness, or swelling?
No.
Okay. Any deformities or limitation of motion?
No.
Any noise with motion? Do you hear any cracking, anything like that?
No.
Or, okay, rubbing? Okay. Any pains in your muscles?
No.
Any cramping in your muscles or
No.
weakness? And how is your gait? Do you have any problems with walking?
No, I walk pretty normally.
Okay. Any back stiffness or pain, or even in the lower, any stiffness or pain in your back?
Yes, I have pain in my back, but I take a leave for it, and
Okay.
it's okay.
Okay. How often do you walk?
I used to walk every day until I started school.
Yeah, that'll do it. What is your effective limited range of motion and on daily activities?
I don't have any limited range of motion.
Okay. So then you wouldn't have any mobility aids.
No.
Okay. Any history of seizures disorders?
No.
How about stroke?
No.
Fainting
No.
or blackouts?
No.
Any motor function problems like weakness, any tics, tremors, anything like that?
No.
How about any sense of paralysis?
No.
Okay. Any problems with cognitive function at all? Or thinking?
No. My memory used to be very sharp, and now it's not as sharp.
Okay. So it's mild, right?
Yeah.
Okay. Any history of like depression, nervousness, any mood changes?
Yes, I've had a history of depression.
Okay. And do you see somebody for that currently?
Yes.
Okay. And who do you see? Your family doctor or psychiatrist?
No, I see a nurse practitioner who specializes in emotional and psychiatric
Okay.
medicine.
Okay. Any history of hallucinations, like schizophrenia?
No.
Okay. Any bleeding tendencies of the skin or mucous membranes?
No.
Any excess? Okay. How about any excessive bruising?
No.
And lymph node swelling?
No.
Exposure to toxic agents or radiation?
No.
Any blood transfusions or reactions to the transfusion?
No.
Okay. Okay. Any history of diabetes?
No.
Okay. Any polyuria?
No.
It's like frequently peeing a lot or urinating a lot.
Yes,
Okay.
actually frequency.
Okay. How about polydipsia?
No.
Okay. That's just excess thirst. Any polyphagia?
No.
Okay. Any history of thyroid disease?
Yes, I have hypothyroidism and I take medication for it.
Okay. Do you see an endocrinologist or do you see a family doctor?
Family doctor.
Okay. And what medication are you on currently for that?
Levothyroxine.
Is it helping you?
Yes.
Okay. Any intolerance to heat or cold?
No.
Any changes in the skin pigmentation or texture?
No.
Okay. Any excessive sweating?
No.
Any relationship between appetite and weight?
Not really.
Okay. Any abnormal hair distribution, like on your face,
No.
chest? Okay. How about any nervousness or tremors? Do you have any sense of anxiety or?
A little bit.
Okay. And how about tremors?
No.
Okay. Okay. How much daily time would you say you spend alone?
8 to 12 hours.
Okay. Now, is it pleasurable or is it isolation?
It's pleasurable.
Okay, you don't mind it. Okay. Any other self-care behaviors?
Self-care behaviors? Oh, showering, exercising.
Okay. Okay. Do you have any current stresses right now in your life?
Yes, school.
Okay. And are you doing anything for the stress?
Yes, I've started working out again.
Okay. No oral medications?
No.
Okay. Do you find the methods helpful that you're using?
Yes.
Okay. Any daily intake of caffeine?
Yes,
Coffee,
I
tea?
normally have 2 cups of coffee a day.
Okay. Do you smoke?
No.
Have you in the past?
Oh, I smoked for about 6 months when I was 15.
Okay. So, yeah. All right. When you did smoke, how many cigarettes did you smoke a day?
About 4 or 5 a day.
Okay, not many. And you have quit?
Oh, yes.
Okay. Do you drink alcohol?
About once a month I have a beer.
Okay. That's fine. And out of the last 30 days, have you drank?
Yes, I had a beer 30 days ago.
Okay, and how many days? Just 1 day, 2 days, a month?
1 day.
Okay. Have you been told that you have a drinking problem?
No.
Okay. Any use of street drugs?
Well, I smoked marijuana in high school.
Okay. Any use of cocaine?
No,
Any crack cocaine?
no,
Amphetamines?
no,
Heroin?
no.
Any prescription painkillers?
Have I used them?
Any addictive
No.
behaviors towards
No.
them? Okay. How about barbiturates?
No,
Okay. Any LSD?
no,
And have you ever been told? Have you ever been in treatment for drugs or alcohol?
no.
Okay. How is your housing in your neighborhood? What would you say to describe that?
Well, I live in an apartment complex that's safe. I don't know my neighbors very
Okay.
well.
Okay. Do you find you're safe here?
Oh, yes.
Okay. Any adequate heat and utilities? Do you have access to
Yes.
water and gas and heat? Okay. Any self-esteem or self-concept problems?
No.
And when was your last education?
A bachelor's degree.
Okay. And how would you say your self-esteem is on a scale?
Oh, 9.
Okay, good. That's good. Any financial status? Income low, adequate for lifestyle? Any
Adequate.
Health concerns? Okay. All right. How about your value beliefs? Do you have any religious values that you
Yes,
practice?
I go to church regularly and I believe in God and Christ.
Okay. No, so for some self-care behaviors, do you try to eat right?
Yes, I try.
How about exercise?
I'm just getting back into exercising after having quit when school started.
Yeah, it happens. Any sleep? How are your sleep hours at night? How many hours of
I
sleep would you
sleep
get?
about 8 or 9 hours a night.
That's good. And do you make good time? Are you mindful of taking time to pay attention to yourself?
Yes.
Okay. In your activity and exercise, what do you do?
I work out at Anytime Fitness on a stationary bike and on all sorts of equipment that
Okay.
strengthens me, and floor exercises.
Okay. Do you have any independent or needs of assistance with ADL?
No.
Okay. Any feeding, bathing, hygiene, dressing, toileting, bed chair transfer, walking, standing, climbing stairs? Any difficulty, or do you have any of those?
No, I don't.
Okay. What are your leisure activities? Do you have any?
I watch TV, I read,
Okay.
and I socialize.
Good. For your exercise pattern, how often do you work out a week?
3 times.
Okay. Any other self-care behaviors?
No.
Okay. And can you recall what you've ate in the last 24 hours?
I've eaten some sweet and sour chicken and some Slim Fast drink and some scrambled eggs.
Good. Is this a typical pattern of your eating?
Yes.
Okay. All right. And who buys your food? Do you?
Me.
Okay. Do you prepare it?
Yes.
And are your finances adequate for buying or purchasing food?
Yes.
Okay. And who is present at meal times?
Just me.
Okay. Any other self-care behaviors?
No.
Okay. How would you describe your role in the family?
Maternal.
Okay. And do you get along typically with your family, friends, coworkers, or classmates?
Yes.
Okay. And do you ever get, who do you get support from for a problem?
A problem?
Yes.
Old friends and my sister.
Okay. And do you have access to transportation?
Yes. I have a car.
Okay. Any involvement in community services?
I worked at blood banks, and I provide food for after church activities,
Oh, that's nice.
and that's all I can think of at the moment.
Okay. How about any hazards in your workplace or any environment that you're in?
No.
Okay. Do you use seatbelts?
Yes.
Do you travel or have you resided in any other countries?
No, but I've traveled to about 30 countries in the past.
Wow, that's awesome.
Visited.
Okay. Any military service?
No.
Okay. In those countries particular? No.
No.
Okay. And what is your self-care behaviors? For that?
My self-care behaviors are that I take a shower, I exercise, I relax, I socialize.
Okay. And any intimate partner violence?
No.
Anything at home that's violent? Any domestic abuse?
No.
Do you feel safe?
Yes.
Okay. Have you ever been emotionally or physically abused by your partner or someone important to you?
My father.
Okay. Ever been hit, slapped, kicked, pushed, or shoved, or otherwise physically hurt by your partner or ex-family member?
My father and my brother.
Okay. Has your partner ever used force or forced you into having sex?
No.
Are you afraid of your partner or ex-partner?
No.
Okay. And please describe your job. You said you don't have one currently, right?
Yes, I quit my job to go to school.
Okay, so you're a full-time student.
Mm-hmm.
Any work with health hazards like asbestos, inhalants, chemicals,
No.
repetitive motions? Okay. Any equipment at work designed to reduce your exposure?
No.
Okay. Any work programs designed to monitor your exposure?
No.
Any health problems that you can think of that are related to your job?
No.
Okay. How do you define your own health? How would you define health to you?
Define my present state of health?
Mm-hmm.
I think it's very good.
Okay. And what is your own perception of it? Health. What is health to you?
What is health to me? Being able to move around, take care of myself, perform the activities of daily living, and do satisfying activities.
Great. And what are your concerns?
Oh, getting old, I guess.
Okay. What do you expect to happen in your health in the future?
I expect it to be good for many years to come.
Well, that's good. Do you have any health goals?
To keep on working out.
Okay. And what is your
well?
What is your expectations of nurses and physicians?
I want them to pay close attention to things I could do better.
Okay.
And to be thorough and well-versed.
Okay. Well, that concludes your health history assessment. Do you have any questions for me?
No.
Okay, thank you so much for your time, Marilyn.